Hello and welcome to the eMedNey computer-based training series for New York State Medicaid providers. This video is part of our prior approval series of tutorials. The purpose of this session is to familiarize private duty nursing providers with the process of requesting prior approvals through ePACES. The key objectives for this session include the eMedNey website, Private Duty Nursing Resources, Prior Approval General Information, ePACES Prior Approval Request, ePACES Prior Approval Responses, Important Reminders, Reference and Contact Information. Private duty nursing resources can be found on the eMedNey website, www.emedny.org. The Private Duty Nursing Provider Manual can be found by clicking on the Provider Manuals tab at the top of the web page. Scroll to select the Private Duty Nursing Manual from the Provider Manual list. The Private Duty Nursing Manual is comprised of several sections. It is important to read each section. The Policy Guidelines section contains detailed information regarding private duty nursing Medicaid policy. Section 6 of the Policy Manual contains important information regarding prior approval requirements. Section 6.1 of the Policy Manual contains the documentation chart. The chart summarizes the documentation requirements for each approval interval. The Fee Schedule section of the Provider Manual contains the fees that are associated with each of the procedure codes for private duty nursing services. The Procedure Codes section of the Provider Manual contains additional information regarding the procedure codes for private duty nursing services. The Billing Guidelines section of the Provider Manual contains important information regarding private duty nursing billing guidelines, general professional billing guidelines, and general remittance guidelines. The Prior Approval Guidelines section contains field-by-field instructions for completion of a prior approval request form. Please review the most recent communication information on the right-hand side of the web page. The communications contains details regarding policy changes and important updates. In this example, changes to the Medically Fragile Children and Adult MFCA program, which became effective on April 1, 2022, are highlighted. To access ePACES reference materials, you will click on Self-Help in the upper right-hand corner of the web page. Prior Approval Quick Reference Guides will provide detailed information regarding the prior approval process. There are ePACES reference sheets available which provide information regarding the ePACES PADVS request and response functions. The ePACES PADVS request and PADVS response reference sheets will provide step-by-step instructions. The following is general information regarding prior approval. Prior approval for all private duty nursing services is required before the start of providing services. A PA request must be submitted by a Medicaid-enrolled private duty nurse or private duty nursing agency and ordered by a Medicaid-enrolled physician or nurse practitioner. It is the provider's responsibility to obtain and submit all necessary paperwork. Approval of private duty nursing services will be for a period of up to 6 months. Full disclosure of primary insurance must be made to Medicaid. Providers must submit for approval to the primary insurance before requesting private duty nursing hours from Medicaid. Receipt of prior approval does not guarantee payment. Payment is subject to client's eligibility and other guidelines. Prior approval for private duty nursing services can be requested on paper, electronically, and on ePACES. In order to access ePACES, you will need to enroll. Please contact the eMedi call center at 800-343-9000 to enroll in ePACES. Once you are enrolled, you can sign in to ePACES with your username and password. You will click on I have read and I agree to the Medicaid confidentiality regulations and then click on Agree, Login. In order to request a prior approval from ePACES, you will click on Initial Request from the PA DVS menu on the left-hand side of the screen. The PA DVS Initial Request window will open and you will begin by entering the client ID in the field labeled Enter a Client ID. The client ID is 2 letters, 5 numbers, and a letter. Enter the client ID and then press Go. To request a prior approval, non-dental, non-DVS will be selected in the transaction type field. Next, you will enter the provider service address and the contact information for the person who should be contacted regarding the prior approval. The ordering provider, physician or nurse practitioner, is a required field and will be entered next. The first step is to review the provider names from the Select a Name list. If the name of the ordering provider is listed, click on the provider name. If the name of the ordering provider was listed and selected from the list, then press Go. After pressing Go, the name of the ordering provider will be embedded into the prior approval request. If the name of the ordering provider is not listed in the Select a Name list, you can enter the last name of the ordering provider. Once you enter the last name of the ordering provider, press Go. Once the name of the ordering provider is returned, click on Select and then click on Select Provider. Once the ordering provider is selected, the name of the provider will be embedded into the prior approval. The provider number, Medicaid ID number or NPI, of the ordering provider can be entered in order to search for the ordering provider. Enter the provider number and then press Go. The ordering provider information will then be embedded into the prior approval. Select Professional, Dental for facility type. For service type, select 74, Private Duty Nursing, from the drop-down list. For the Release of Information field, select Y, Yes. Provider has a signed statement permitting release of medical information. In the service date field, enter the from and to dates that correspond to the dates of service included in the prior approval. Do not enter any information in the pattern of delivery, home oxygen therapy, or home health care fields. Click on Next. In the service dates field, enter the from and to dates that correspond to the dates of service included in the prior approval. Enter the appropriate procedure code. Procedure code S9123 is used for RN services and S9124 is used for LPN services. Enter a modifier if a modifier applies to the services. TT is an example of a modifier. TT is used when billing for individualized private duty nursing care provided to more than one patient in the same setting. Enter the total number of hours being requested in the unit count field. Enter the total dollar amount for the total number of hours requested in the line amount. The line amount is calculated by multiplying the number of units by the fee per unit. Please refer to the Private Duty Nursing Fee Schedule for the fees that are on file. Click on Submit. Once you click on Submit, you will receive a Request Submitted message. Click on Responses under the PA/DVS heading on the ePACES menu. The response is displayed. In this example, the approval is in pending status. Supporting documentation can be uploaded by clicking on Image Upload. Select the image type, file type, and browse your computer to find the file needing to be uploaded. Click Upload. Once the file is uploaded, you will be provided with information regarding the upload at the bottom of the page. If supporting documentation is going to be faxed, you will need to obtain the fax cover sheet form and the electronic attachment scanning form from the eMedNY website. The forms can be found by clicking on eMedNY Paper Forms from the Information tab. Please refer to the fax cover sheet instructions and complete the fields on the provider fax cover sheet. Please refer to the electronic attachment scanning form instructions to complete the electronic transaction attachment scanning sheet. Once the documents are uploaded or faxed, click on Responses again under the PADVS heading from the ePACES menu. This example is showing an A3, not certified response. The response states that the services were not considered due to other errors in the request. The request will need to be reviewed in order to identify the error. A review ID number will not be provided for an A3, not certified response. This is an example of an A1, certified in total response. The review ID number will be included on the A1, certified in total response. The review ID number is the prior approval number for your claim and will need to be entered in the prior approval field. Important reminders. Prior approval for all private duty nursing services is required before the start of providing services. A prior approval request must be submitted by a Medicaid-enrolled private duty nurse or private duty nursing agency and ordered by a Medicaid-enrolled physician or nurse practitioner. It is the provider's responsibility to obtain and submit all necessary paperwork. Approval of PDN services will be for a period of up to 6 months. Full disclosure of primary insurance must be made to Medicaid. Providers must submit for approval to the primary insurance before requesting private duty nurse hours from Medicaid. Receipt of prior approval does not guarantee payment. Payment is subject to client's eligibility and other guidelines. Prior approval for private duty nurse services can be requested on paper, electronically, and on ePACES. For additional information regarding private duty nursing services and prior approval, visit the eMedNY website at www.emedny.org. Refer to your private duty nursing manual, as well as the ePACES reference sheets. Feel free to call the eMedNY call center at 800-343-9000 for any questions or to request additional training. This concludes our ePACES prior approval for private duty nursing tutorial. Thank you for joining, and please visit us at www.emedny.org for additional training resources.